I started in the dental business in 1976. Then I started in sleep apnea in 1999. Let's see what I found out. Sleep apnea is the definition: a suspension of breathing, absence of respiration without breathing. Here are some examples of the airway open, and then airway blocked. And then usually the sleep labs try and give you the CPAP machine, which pushes the airway open that way. At the beginning of these jaw advancement devices on the market, I tried each one to see what I found. Let's see what I found. But here's the CPAP machine. Can you wear this device to bed with the straps and everything? Okay, we started from the most used to go to the least used of these devices on the market. And this one has straps on the side that actually stretch, and then there's ones that don't move at all, and that's like this one here with the stylist, and it has little adjustment places on there to get it more forward to see how much you can handle. And then here it is in the mouth, and then here's another device with a screw in the front to pull you more forward, but no side to side or front and back, just like this one with a little expansion screw there. That's pretty incredible. They won't let you move around. And here's one that doesn't move around also, and it has cheek things. And then this one has little screws on the side to pull it more forward, but no front to back. This one doesn't move side to side or front to back with a screw adjustment on the side. Okay, this one suctions onto the tongue, which pulls the tongue forward. And then this one's used with many dentists, and they don't know that this is for snoring only. This one depresses the tongue to keep it still so it won't fall back in the mouth. And then this lower device here goes down the throat and holds the tongue forward with that little strap. This strap here keeps your mouth closed so that the sleep right will stay in motion. A lot of those ones you buy over the counter. This is my device. It's very good. It's got a nice long adjustment, no screws. You just pull it forward and lock it forward. And then it's got the tube on the front, which is like a big rubber band that kind of gives you resistance to let you go back, but when you reach REM sleep, it lets you fall all the way forward. These are some of the indexing materials that I like you to use: alginate, zinc oxide, eugenol, Memorex, made by Colzer. Now let's look at the lower jaw when it's closed. There's no breathing done, and that's when you go through apnea. So what we do with the jaw advancement, we try and pull it forward, and it opens that airway really nicely and lets the air in. That's why we pull it forward. So we practice with the patient, and here he is going forward, practicing a couple of times so he knows exactly what you want to do when you get ready to take your bite plate. So now what you do is you mix up your indexing material. This one will be alginate, and we put it on the bite plate. And you just put as much as you want. It just needs to copy a few of the posterior teeth, not so much the anterior or the front teeth, because you just want it to copy the back teeth so it has a nice biting surface. And it gives you very good indexing with that alginate. I like it the best. Sometimes when you're too far away you can't use it, but this is probably one of the best materials out there. I don't like the blue mousse. It kind of bounces around as you try and use that as a bite material. But here it is. You put it in the mouth, have the patient bite forward. You can slide around. You have a few minutes to play with it. Okay, there. And then it's only biting on a few of the front teeth, which lets the T.M.J relax. And now here it is. We're going to pull it out, and we'll see what kind of good indexing it does with that alginate. It's very nice material. See, it's even hard to get out because it has a good suction on the teeth. So you just work it loose. You don't want it to tear loose of the bite plate. There it is. Snaps out. Since I've been doing this since 1999, it really works out well. There it is. It's very easy to go back to the articulator and put the models on, and copies it very well. Now here's my device. It's covered by the tube in the front, so it doesn't contact the rubber band, but it keeps your lips open so you can breathe nicely. And it has nice side to side because it's a polished surface down there, and there's nothing in the way of the tongue. And lets you move in all directions, even backwards and forwards and all around. So it's very comfortable as far as the jaw advancement devices are concerned. So if you have any comments or questions, please contact either my website or my email address. I really appreciate any feedback. It goes into perfecting this device, but I think it's perfected already after 11 years at least of